Good morning, John. Good morning, Diane.
Good morning.
How are you?
I'm okay. How are you doing?
Doing well today, thank you. I had a nice time seeing you at the pizza party up there in
Yeah,
Seattle.
it was good to see you as well. Yeah.
Um, I think maybe you're gonna have a meeting. I don't know which volunteers are engaged, but Sam is going to be meeting with Carol Ann to talk about mentoring in the year ahead. So I appreciate your support with that.
Yeah. Yeah, happy to do that.
I think you and I have the same instincts about um, best practices for that. More consistency.
Right.
That's
That's
my
the
shorthand.
way to go. Yeah.
It's a bit more complicated, but that's my shorthand. There's my old good friend Don Berg. Don, I saw a picture of you at an outreach event and it made me smile, and I'm happy that you're back and I hope you're feeling well this morning.
Thanks, Tim.
Happy New Year.
Happy New Year to you.
Good morning, Wing. How are you?
Good morning. How are you? Happy New
I'm very
Year.
happy New Year to you. My wife is very excited that when the Lunar New Year comes, it's the year of the fire horse. Morning, Maureen. Wing, you might just adjust your camera a little bit.
Oh, okay.
See more of your beautiful face. There you go.
Better?
Yep, you got a good haircut.
Ah, thank you.
Don, you kind of have a good haircut, but it's not the same effect quite as Wing.
Well, it gets a little shiny.
You gotta have more moisturizer this time of year.
Well, we got a lot of rain down here, so I got all the moisture I want.
Yeah, that you're not alone in that. We have kind of catastrophic flooding around the state, and now we're starting to get complaints about processing claims.
Yeah.
Morning, Linnell.
There we are. Good morning.
There you are. Nice to see you. I think I have not seen you since we were there in the summertime, right? For appreciation for Tina.
Oh, well, no, I've been on in the fall. In the fall,
Okay. No, I mean I
just
haven't
not in
seen you.
person.
I know
Yeah,
you're working. Yeah,
yeah.
yeah, yeah. I'm going to have let me fix my screen here for a second. Um, Turn off the blur so you can appreciate this cookie that I'm going to eat while we're gathering here. So I'm having this little I call these thumbprint cookies. I don't know what you guys call these. Um,
Are, are those Christmas leftovers or?
they are Christmas leftovers. So the story about this is that my wife's family is from Vermont, so we go back to New England for Christmas. And family friend, a guy who's a retired vet, moved from Philadelphia, retired to Vermont. And every year he gifts my mother-in-law this cookie package from this bakery in Philadelphia.
Ah,
And she doesn't have the heart to tell him that she doesn't like them. So she just gives them all to me to take home. But I'm very excited about it. So I'm like, tell Joseph I love the cookies. But she leaves out the part about she sent them all with me. She doesn't want to hurt his feelings. I'm like, I think he could take it, Sandy. I think he'd be all right knowing that. Good morning, Judy. That's for Judy Kenning, my
Good
other
morning. How are you?
person. Very well, thank you. How are you?
Good. I'm great.
Excellent. Excellent. Good morning, David. Good morning, Barbara.
Good
Thank you
morning.
for being here. There's my friend Paul Bradley. Good morning, Paul.
Good morning, Tim.
How are you today?
I'm doing well. How
Excellent.
about you?
Also doing well, thank you. It's a good start to the year here.
Yes.
We went to Port Townsend for New Year's Eve, so got to see some friends up there. That was nice.
And you were in the East Coast for the holidays.
I was. My wife's family is her dad, Jim is in a nursing home. He lives at the Vermont Veterans Home now. He's got advanced dementia, and that's in Bennington. So we flew to Boston, got a car, drove to Bennington to see him, and then drove north to Wallingford, Vermont to pick up my mother-in-law, Sandy, and then we drove over to Portland, Maine. Stephanie is a twin. Her brother lives there. And then to New Hampshire to see her favorite cousins and her favorite aunt, and then back to Boston again.
Wow, that's
So
wonderful.
got a little,
I'm from the East Coast originally, from Boston, and I know Bennington, Vermont very well. I used to
yeah,
go there every year. There's a piano camp in Old Bennington that I participated in for many years.
okay.
It's run in a very old, humongous house with 30 pianos, etc. But anyway, I love Bennington. It's a very historical and beautiful area of Vermont.
It is. It is. Yeah, Bennington's a fun little place. I mean, everything's little there, right? There's no city of any consequence. But yeah, Bennington's lovely. And it's end of life conversations are hard and nursing homes, but boy, that is the best run place. It's been there forever. It was kind of conceived as being a place for guys returning, from the Civil War, and so it's been there forever. And it's a state-run facility, but they have excellent quality ratings, and the staff are amazing. So, um, not that you look forward to going, but we see the same people. They have good continuity, and so it's a good visit. It's important to me to visit. But yeah, Vermont is beautiful. I miss my brother-in-law and I are both, like last minute Christmas shoppers. And actually they're both Christmas Eve babies. So we used to have this tradition that we go to this town next door in Manchester and go to the bookstore and buy books and gifts for everybody and then go get a couple of beers and then go home and have Christmas Eve. But now he lives in Maine, so I have to go to the bookstore and drink by myself. But it's not a hardship. I figured it out. Okay, Susie, are you going to help run the screen this morning for me?
Yes, I can do that.
All right, welcome here. Thank you for that. And maybe we'll give people a couple of minutes to gather. Devin, I saw that you're here. Good morning. Thanks for being here.
Good morning.
Haven't talked to you in a little time.
Yes,
How are you?
I'm doing well, thank you. Things are all good over here in Kitsap County.
Okay, that's good. You're representing for the whole county. That's brave. Oh, let's see. We have a couple of folks from Spokane. Mike is here and Lou is here. Good morning, the Spokane contingent. We had Monica yesterday. Lou, you had a very productive open enrollment, about 16,000 beneficiary contact records, I think, from you. Give people a couple of minutes to gather. Thank you for being here. Appreciate that. I did send you kind of a slide deck ahead of time that Susie's going to use on the screen. So a little bit of an agenda, trying to have a compact agenda so we have ample time for conversation. Interested in your experiences and insights about 2025 in general, but the Medicare open enrollment period specifically. Challenging, I think, challenging open enrollment, but good open enrollment. Challenging year, but good year. 2026 going to be a challenging year for sure. Ample challenges. I am confident no one's going to get to the end of the year and complain of boredom. We don't have that to worry about. Cross that off our worry list. Scott Opsel, good morning. How are you?
I'm good, Tim. Good to see you.
Good to see you. Got you and your friend John here from Bellingham.
Good. I haven't seen his picture yet, but good. Yeah, I know Micah's
Hello.
going to attend tomorrow.
Okay. Okay, that'll be lovely. I haven't seen her in a little while. I need to come up and visit you guys.
Yes, it's been too long, Tim.
It has. It has been too long. It always feels like too long. But yeah, it has been too long. I was
You know,
just
we
saying to
all feel
Shannon,
that way about you, Tim. It's always been too long since you've seen us last.
oh, that's
It's
kind.
just not because you don't see us, it's just that we like seeing you and having you come in person.
Well, I appreciate that, Scott, and I know that you're being sincere, so I appreciate that. I will get up there. Here's my friend Jean Matheson. Good morning, Jean.
Good morning, Tim. How are you?
I'm well. How are you?
Doing well too, thanks.
I'm going to have tea and a cookie on the call today. I'm looking forward to that. Oh, my friend Shelley is also here from Bellingham from Northwest Regional Council. Good morning, Shelley. I haven't seen you in a while.
Good morning. I haven't seen you either. Nice to see you.
I did go back to see our friend Tasha at the Sauk Saddle Tribe, but I missed you.
Oh, you
And
did?
I was over at we were over with our friends at the Samish, but you sent James to that
Oh,
one.
yep.
Yep. He's lovely.
Yeah, gosh. That brought something to my mind about a client up there that I'm going to need to touch base with her about. Thanks for the reminder.
Let me remind you of all the work you have, Shelley. The oppressive workload that you're dealing with.
I better make a note of this.
Right. You and me, we're gonna have some work about. I have a slide in here about supplemental long-term care insurance and walk cares fund. So we're gonna be doing some work with you guys about that here pretty soon.
That's good to know. Thanks for letting me know.
Yeah, I feel like so I guess by way of introduction, Shelley is one of my favorite people to work with. Shelley is officially assigned to the Northwest Regional Council, and their service area is Whatcom County, Skagit County, Island County, San Juan County, but mostly Shelley and I overlap on working in Skagit County, and we've done a bunch of work with tribal elders and this space around qualifying for Medicaid programs, LIS MSP, or alternatives to institutional care. So that's kind of the space that you and I overlap a bit, right? And we're gonna, I think, right, my hope in our support for the Walk Cares Fund and supplemental long-term care insurance is to help more people get connected to public assistance that qualify. So I think we should have interesting opportunities to work together.
Yes.
Carol Edgerly, how are you? Are you going to come on screen and say hello? I haven't seen you in such a long time.
Good morning. I'm exhausted today. It was a long day yesterday.
Okay.
So,
all right. How are you feeling though in general?
Well, overall I'm okay, but looking at that foot of snow out there, fortunately I have a snow shoveler guy here.
Okay.
And all things considered, I'm not showing myself today.
Okay. And tell people where you live that you have a foot of snow, please.
Cle Elum.
Cle Elum.
Yeah. Cle Elum, yes. We got all coming home from Yakima yesterday, we got all the way to Elk Heights before it's, well, the bottom of the Tatum curves, before it even started to snow. And there wasn't much of anything, just a little bit at Elk Heights. And as they came down the hill, it got uglier and uglier. And by the Indian John rest stop, the cars were doing 25, 30 miles an hour with the four-way flashers on.
Okay.
And got home to a foot. And I still had to shovel a walkway for the dog because my next dog is going to be a Great Dane. Not a 13-pound little thing that doesn't have long legs.
No more lowriders.
No more lowriders. No more lowriders.
All right. Well, I'm happy you could join us today. It's been a while since
And,
I've seen you.
and Happy New Year to everybody.
Happy
Well,
New Year
and
to all of us.
Carol, be careful what you wish for because we have a dog that is mostly Great Dane. And when he drinks, there's just streams of water everywhere. So we also have a Chihuahua poodle who's about 17 pounds, and that doesn't happen with him.
Well, I once had a Neapolitan Mastiff that weighed 140 pounds, and he was a minimum size. And you didn't want to be anywhere near him when he shook his head. For those who remember Turner and Hooch, everything he knew, he learned from Hooch. But he
All right,
was
Carol and I are going to definitely we have to have a good long separate dog discussion because I could go all day with you.
okay.
Great. Peggy Groundwater, good morning. How are you?
I'm doing fine, thank you.
Nice to see you. Seems to be that you're in your office at the Orcas Senior Center.
Actually, no, I'm at home. I'm going in the afternoon.
Mm,
Yeah, that's my bedroom wall is very bright.
okay. Thanks for joining us. Nice to see you. Happy New Year to you and Michael. All right, Susie, you ready? We're going to get started then. I want to acknowledge that we're recording the program today because some people like to hear the program or hear the program over again. And so Susie will capture a recording and then post that to our website. I want to just say again, thank you all for being here. Appreciate it very much. Susie, can we go ahead to the next slide, please? This is our SHIBA Town Hall program for January. And Susie, do you want to, for people that don't know you, do you want to introduce yourself, say hello?
Sure. Yes. Good morning, everyone. My name is Susie Tegman. I am the SHIBA coordinator. So I primarily manage the volunteers onboarding. So what that means is when a application comes through, I initiate the onboarding steps related to the admin type things. So that means a background check. I assign trainings through tracks and basically help them along their journey to get through basic training and beyond.
Beyond.
So good morning, everyone. Thank you for being here today.
Excellent. Thank you. And the next slide is my contact information. If we haven't met, I'm Tim Smolin. I'm your SHIBA program manager, and I am looking forward to meeting you. I have a lot of respect and affection for you and a deep appreciation for the work that you do every day. Whether you're a brand new person or an experienced person, whether you do a lot of work or a little bit of work on the record, it all matters. And I'm sincerely grateful for. So my first purpose always in organizing these meetings is to, for me, just to thank you directly for your work. I want you to know how much I appreciate the work that you're doing. It means so much to me. So this is my contact information. I really am sincere that if you want to reach out to me, I'm better on email, but you can call or write. I will make a point to get back to you and check in. It's by no means like a vote of no confidence in our team here or the volunteer coordinators that you work with, but I just want you to know that you can correspond with me directly, get help with cases, problem solve things, ask about the direction of the program, or it's all welcome. So that's how you can get a hold of me. And as Scott and I were saying, I do try to come out and see you guys as much as possible. So hoping to connect with you again soon in the year ahead. Carol will wait for a little bit of snow to fall before I come to Cle Elum, but I will get to Cle Elum again and see you. Okay, Susie, can we go ahead? So here's our agenda for today. We'll talk about some updates in staffing for our SHIBA team. I'll share with you my perspective about 2025 in review, and specifically the Medicare open enrollment period, a little bit of a preview about what I expect for 2026, a little bit of future forecasting about what's happening with the state government and the federal government and how those things will affect our work together and your work with beneficiaries. And then I'm hoping I have a relatively compact program so we have ample time for questions and answers. Of course, please raise your hand or use the chat or just shout out at me anytime if you have a question, but I'll try to stop kind of topic by topic and take questions along the way. Okay, Susie, let's go ahead. So we have across 2025 expanded and reorganized our team a bit. A note here is that the funding for the Office of Insurance Commissioner, our agency is funded differently than most of the state government agencies that you're aware of. So the funding for our program comes through what's called the Insurance Regulatory Account, which means that in our state constitution, we have a provision that the industry bears the cost of its own regulation. So essentially, there's a tax on premiums that the agency collects, and we pass that money on to the state general fund. So we're a net contributor to the state general fund, which is how most of state government is funded. And out of that, then we request an appropriation to fund our operations. When Patty Kuderer took office back in January 2025, we sent a proposal to the legislature, which ultimately was funded to increase the complement of people in our team by 6 and about $3 million, most of that to go out to our contractors. So we're very excited to be growing our team. You've met some of the people across 2025, but you haven't had a chance to meet Millie or Callie yet. And I don't know, are either of you on the phone and you want to say good morning to people? I don't see you on my participant on screen list, but I don't want to miss you if you're here. So Callie's role is similar to the role that Philip has and Diane. So it's the job that we call Medicare Complaints Coordinator, which means that they're working complex cases, what we call constituent referrals. So referrals that we get from elected officials or other state agencies, and also some overflow work in cases where there's not enough capacity in the field to work cases. Millie is part of our insurance technician team. We call Medicare Specialist is the working title. And Millie is helping us manage the hotline. So she's the first point of contact for people that call 1-800-562-6900. Then you get Millie, and Millie's script is something like, please tell me where you're calling from and what you're calling about so that we can help you. And if it's going to be, I'm turning 65 in June and I live in Whatcom County, then she's going to refer that call over to Scott and John's team there at the Whatcom Council on Aging. So couple of new people more coming. We're going to be doing a bunch more hiring in the year ahead. For this session, we have a decision package to add 6 more people to our team in a role like Millie has. And I'm working on my package for the next session, which will be another 6 people. So I'll have more to say about that when we get into the third quarter conversation. We also have made a reorganization. So we promoted Amy Fagoni. I don't think Amy is with us this morning, but let me check my list. Amy can come online. But we initially recruited Amy as a regional training consultant. We promoted her to be the operations supervisor and now promoted her to be the operations manager. I sent you kind of an abbreviated org chart, but essentially she'll be working with Kendra's team, and then we'll be hiring behind her team to provide some support for the trainers, the folks who write curriculum, and then Callie and Philip and Diane on the casework side. So congratulations to Amy. It's a well-deserved promotion and very happy for her. And can we go ahead, Callie? Excuse me, can we go ahead, Susie? So here's my strange looking kind of pyramid diagram where I'm trying to represent that our purpose here in growing our staff team and seeking this increased funding really is to make sure that we're providing enough support for our sponsor organizations. We have a bunch of volunteer coordinators here, so I'll just pick on Peggy Groundwater from the Orca Senior Center, right? So our goal is to make sure that we're giving the right kind of support, both financially and in terms of material support to Peggy and Lena and the folks there at the Orca Senior Center. So again, part of the budget package that we asked for was to create an opportunity for more funding for the Orca Senior Center so that they can advance their work in the community. And then in turn, and Peggy is actually excellent at this, recruit more volunteers into our team and do what I affectionately call care and feeding of the volunteers, so that in turn we can help more beneficiaries and to improve our outreach to the people with the greatest social and economic needs. So that the idea is that really the purple colored team, our team growing is really meant to enable and lift up you all as volunteer advisors and sponsor organizations so that we can improve our effectiveness out in the field. So if you can imagine two of these pyramids kind of side by side, then the intention is to grow the SHIBA team so that we can grow the sponsor team and invest more in those organizations so that we can grow our volunteer network. My ambition is that we would grow from the current about 200 volunteer advisors to about 600 volunteer advisors over the course of a few years so that we can reach more Medicare beneficiaries. Round numbers wise, we're at about 1.6 million Medicare beneficiaries in the state, and that number is growing fast. So the idea is to kind of keep pace by making sure that the support you get from our team and the funding you get through our agency is keeping up with the demands in the community that you work in. Can we go ahead, Susie? So as I think about, from my vantage point, 2025, I think we had a very good year. And obviously we were really focused on building capacity in our team. So we grew our network of volunteer advisors. We engaged several new sponsor organizations and community partners, and we grew our staff team. So we're not keeping up with demand yet, but we've made a lot of good investments in kind of that foundational work. So in that regard, I think it was a very good year for us and for you. And can we go ahead, please? So here's a review about the Medicare open enrollment specifically, and I sent a lot more data to each of the volunteer coordinators. So if you go with Peggy, you can check in with her. If you go with Mike Dalick in Spokane, you can check in with him and Monica. Annette Barca is here for Island Senior Resources. But at a high level, and I ran these data on the weekend, so I know some of you still have some catch up with STARS data entry, but we had 221 people create at least one beneficiary contact record in the STARS database. You all clocked more than 8,900 hours and served almost 12,000 beneficiaries. So in terms of the data aspect, a very, very successful year. Kind of my shorthand is I tend to say that we do about half of our work during the Medicare open enrollment period. So far, the data would say 43%. So if I look at across 2025, we're pushing on about 27,000 beneficiary contact records, which is a very good year for us. And as I say, we have some more complete data about kind of unpacking that a little bit. But I would say one of the highlights for me, something that I'm tracking, is continually increasing the number of face-to-face visits. So on 2025 cycle, we're on the high side now of 30% of those beneficiary contact records were face-to-face compared to phone or virtual. And if you imagine starting back from like pandemic, the pandemic response to the public health emergency, where we were essentially 100% phone calls, to get the 30% in-person visits is a really big deal. It's been trending that way. I expect it's going to continue to trend that way. I think that's a positive outcome. And I'm just acknowledging that it's much more effortful for you as volunteer advisors, for our sponsors to support that in terms of locating sites and arranging meetings and the technology, et cetera. So I think it's a good outcome and something that we're just tracking to pay attention to. I guess another big success relative to Medicare open enrollment is we did create and promote and distribute the Medicare Open Enrollment Jumpstart Toolkit. The focus of this was on distribution through libraries and senior centers, and we had kind of a multimedia approach, including radio, streaming, social media to support awareness and the availability of these. I've heard generally very positive reviews about it. So I think that's kind of a signal success for us. And let me specifically appreciate Kendra and Rosie and Linda for their leadership in making that happen, and to thank the volunteer coordinators and the volunteers who helped with that as well. And can we go ahead, Susie? Okay, let me stop here and ask for questions or feedback about Medicare open enrollment. People want to share their insights, experiences, kind of lessons learned, or 2025 year in review. Let me just take a pause here and make a space for you to do that.
Okay, I'm willing to toss my 2 cents in.
Come ahead, Carol. Try again, Carol. You're on mute there.
Oops, it shut off again. There it is. A lot of people on Advantage plans. In Kittitas County specifically, Advantage plans have major disadvantages in that adjacent counties don't accept the Humana plans, which is the only company available to the general public. There are more in the special needs, but there are a lot of people on the plans, and the problem is once they're on it and have been on it for a year, they can't get off. Now, last year we could have gotten a lot of them off it because Humana discontinued their plan, but they didn't know to call us.
Yep.
And I mean, I know people that talk to, I don't know who they talk to, insurance reps, Medicare, whoever they talk to, recommended WellCare. Well, the primary medical provider in the county is KVH Hospital, which owns several of the clinics, 2 family practice, orthopedics, cardiology, neurology, a whole bunch of stuff. And the hospital did not accept WellCare. I, in fact, talked with the CFO at that time, and he said WellCare never even approached the hospital to sign on. And they had 1 provider listed. And I don't know how they got away with even trying to sell without any better coverage. But my suggestion, and I know that there are very few states that do this, would be that if you're on a Medicare Advantage program, it is considered to be valid insurance to give you guaranteed issue into a supplement, because right now they don't have that. Yep. And it puts a lot of people at a real disadvantage because they don't realize until too late that, oh, this wasn't a very good idea.
Yep. Thanks for that, Carol. You packed a lot of things in there for me to react to. So
yeah, and this could apply to a lot of the small counties.
For sure. Yes.
Yeah, that only have one company.
And and for WellCare and Humana both, that is also true, right? That's the phenomenon you're describing is not peculiar to Kittitas County, and those two plans are like a recurring theme for sure. Yeah, that was a really I'm trying to think where to start reacting. That was very helpful. So let me start backwards and say about guaranteed issue rights and switching rights. A big driver of our work this year was people that got those discontinue notices from their MA plans, from their Medicare Advantage plans. We had about, round numbers wise, about 50,000 folks with Kaiser. And of course, that's primarily concentrated in the Puget Sound area, and about 20,000 for Community Health Plan Washington, many of those in Central and Southeast Washington. So that was definitely a big driver of work for us again this year. And there was other plans around. I know Judith is here from representing for our friends in Clark County, although she lives in Olympia, but down there it was Pacific Care, Pacific Source, and around the state there was a bunch of that. In reaction to that, we have had a lot of inquiries from state elected officials about changing the rules in Washington state about guaranteed issue rights. There was a couple of bills last year that were introduced into the session and had a hearing, a work group hearing. My friend Maureen Hill is on the call this morning, and Maureen and I went over to the Capitol and provided some testimony. I think at least one of those bills may come forward again this year to expand guaranteed issue rights. And as we did last year, we'll provide technical input about that. I'll say the concern that we have, I'm speaking for the insurance commissioner for Patty Cooterer here, is just we want to be really thoughtful about the trade-off between increasing people's access for switching from MA plans back to Medicare supplement plans, with the impacts that would have on either the rates for those supplement plans or the availability, right? We don't want for companies to exit the market because they feel like it's not going to be feasible for them if we see a lot of adverse selection, if we see the very most expensive patients switch, right when they expect to use a lot of expensive care, that would put a lot of upward pressure on the rates, and we may see plans react to that by exiting the market, right? Or raising the rates. And I know that you all are aware because you're experts and you do this work all the time, but we're already, kind of baseline coming into this where this is the second year in a row that we've had double-digit rate increases for, the most popular Medicare supplement plans. United Healthcare AARP, that plan in particular captures almost 70% of the market, and they've had 2 years in a row of 12, 13, 15% rate increases. So we're just trying to be thoughtful about the trade-offs involved in that. And we have not taken a policy position so far. We're just providing technical input. And I know that we're going to be asked to do that again. There is a coalition of groups that have approached us. I'm going to take a meeting with them in a week or so, and we're going to have that conversation so that everybody is aware of kind of the dynamics of that. It's not simple. And you're 100% right, Carol. This happens in Spokane-Whitman County. This happens in Klickitat County, right? This happens in Central Washington. I made a trip to OMEC this year in the fall, and right in rural areas, this is a very, very big deal for people. And that churn, last year we had lots of calls from Columbia County and Asotin County. And it is around access, and it's very disruptive, right? So I think that's going to be some of what we continue to do for a long time. And with Humana in particular, this year they did not get contracts with the University of Washington Health Medical Center, with the Optum clinics in Everett and Seattle. So we're going to have another kind of displacement of a lot of people from their MA plans. So it's a space that we don't have much regulatory authority. Essentially, the federal law preempts the states from doing regulation about the Medicare Advantage plans. You also talked about agents and brokers, and I know we had a little bit of a dust up with your friend Catherine and one of the local producers there. We spent a lot of time unexpectedly this year because a lot of the plans, Medicare Advantage plans, reduced or eliminated commissions for agents and brokers. And so we had a bit of an unusual year that we got a lot of referrals from agents and brokers because they wouldn't work for free, or they weren't able to successfully help people. So that is definitely going to be more work for us in the year ahead as that kind of settles out. So yeah, there's a lot going on in Kittitas County that's getting replicated kind of around the state. And I think it's, as I've said in past meetings, it's going to be a while before this market matures, and there's going to be a lot of churn, unfortunately, in the meanwhile. Hey, Maureen, what do you have for us? And then Peggy, I'll come to you.
Just, you don't have to respond, just a couple of, I guess, observations that we can deal with or not deal with, as the case may be. But in terms of the open enrollment slide deck,
yeah.
We as presenters had problems with it. Invariably, no matter how you advertise, at least in our experience, I'll have to couch this by saying in our experience, no matter how you couch your presentation, the attendees will be a mixture of both open enrollment and new to Medicare.
Yes.
And so limiting the slide deck the way it was too limiting. And so I would have suggestions for, we would have some suggestions for redoing that for open enrollment next year. We wound up in some cases, just using the Welcome to Medicare, the initial slide deck. And the second thing with the toolkits, we would have some input to, if you're going to use those again and distribute those again in the next year, we would have some comments on inclusion in that packet as well. And the third thing, I don't know if there was some issue with CMS setting up presentations this year that they didn't follow through, but definitely trying to get it straight who's doing what in terms of library presentations, because I think there was some confusion. I think you guys had to fill in some areas where there weren't presenters from the jurisdictions, from the sponsoring agency. So just in terms of facilitating the open enrollment, those would be the three comments that I would have.
Thank you. Yes, we did have some challenges again this year with CMS. Some of that was about shutting down the federal government for a while. But yes, for sure we can do better coordination. It is the intention to use some version of that toolkit again for the next open enrollment period. So we definitely would love to have a conversation with you all, but Maureen, with you and Kelly and the folks at Senior Services. But yes, for sure intending to continue, and for sure would welcome your feedback about making it better and what to include or not, and appreciating your feedback about mixed audiences at presentations. So all of those things are on point, and I took a note to follow up with you.
Thank you.
Mm-hmm. Hey, Peggy, good morning.
Sorry, I was trying to unmute. Good morning again. Mine's actually different. We're seeing a lot of cleanup this month, more than we typically do see. Many of them are people switching Advantage plans, discovering, as other people have talked about, that the medical network isn't what is expected. And I know that CMS had said that the information about providers would be accurate as of January. but it's still inaccurate in there. And I don't know how we contact CMS about that because it's still showing most of our doctors as not accepting plans, but their director has assured me that they have contracts and they do accept the plans.
Okay, I can help you with contact at CMS about that.
Okay, and then the other thing, unrelated to open enrollment, I've had requests from my volunteers with the cutbacks, particularly in the federal government. We're having a lot of problems with social security. We've had more people who are trying to enroll who discovered that Social Security has their sex inaccurate or their name inaccurate or their date of birth inaccurate. And trying to reach, where we're on an island and they're an hour and a half away, trying to reach them by phone, you really depend on whether you get somebody who's willing to help or somebody who just says, make an appointment, come over. Is what my volunteers would like, if we can get that, is something like a unique ID that we can use with Social Security for problems.
Yep.
They'd also like the same thing for DSHS with MSP problems.
Okay, I'm taking some notes. Apologies for looking away.
No, that's fine. I did want to pass on those specific requests. That would make our job a lot easier.
Okay. Yep. Okay. So I'm gonna take that kind of in the spirit of it. I don't. We're not going to be able to stand up like literally like an analog to the unique ID, but we can definitely work on some kind of key point of contact and escalate things that aren't working well. It's
That
been
would
a
be very helpful. Thank you.
very tough year for Social Security. I mean, I know that you all know that they went through kind of this horrible Doge exercise
Mhm.
early in the year, and then they had layoffs and reassignments, and then they reconsidered those. I mean, so we literally had people who were told, "You're reassigned on Friday," and then on Tuesday said, "Oh, never mind." I mean, it's just been a horrendous year for our colleagues at Social Security, and then officially the offices are not closed, but you have to schedule an appointment 5 months ahead of time.
Right.
So yeah, so I guess what I'm saying is I, I can help, and I'm meaning to speak generally to all of you. We can help with some key contacts and some escalation and how to engage Callie and Diane and Philip when you get stuck. But and DSHS, I'm a little bit ahead of my slide deck here, but it's going to be a tough budget year. We had a bunch of layoffs already. We call reduction in force, and there's going to be more of that again when the session starts next week. So it's been hard with DSHS. It's going to continue to be hard, but the bureaucracy is, there is a separate unit to specifically process, state premium payments, the buy-in unit. So we can help make a better contact, Peggy, between those agencies and the volunteer coordinators. And we have had a standing meeting with DSHS and HCA. We kind of took December off just because of the timing of the holidays, but I'll make sure that we engage all of you all as volunteer coordinators so that you can like real directly have a seat at the table and have that conversation with them.
Okay, that would be great because Angie Gonzalez has been fabulous on anything that relates to Medicaid, and we just need something similar for MSP.
Yes. Yep. So thank you for that. That's great feedback, and we can help with that. Good morning, Annette. How are you?
Pretty good. And you? A couple things. We ran into and are running into a lot of issues with people finding one providers, and that the device that was part of the plan finder was in many cases not accurate. I would say of the clients I personally worked with, probably 20% of them were able to find their provider on the list as to being somebody who might take a plan. We ran into several cases, several of the names I tried just, but I was playing around with, so are people who retired 2 and 3 years ago. And the lists are not up, are supposedly updated every month. And they obviously, if they've retired, or in one case, an Everett provider, I ran the name on, he died about 18 months ago and he's still on the list as being available. So there's a problem.
Yeah.
Another problem is oftentimes clients are wanting to sign up for PPO plans and finding that the only plans that some of their clinics they want to go to are taking in HMOs and they're not comfortable with the HMO structure. That's a big issue.
Yep.
And I know that from an insurance point of view, the companies like HMO because they have more control over who they go and how much they reinforce. A third issue, which is not really open enrollment, but is post-open enrollment, is that a lot of our people are finding out that their current plan, which is Humana, is no longer being accepted by any of the Optum clinics, which is a major Snohomish County, King County area. Polyclinic and Everett Clinic are now called Optum, and they are only accepting for Advantage plans. They are not accepting Humana anymore because they haven't come to an agreement on it. So the people have a special enrollment to make a change, which is good. But the alternative I found also with some people who are now turning 65 who are providers for and wanting to go to Everett Clinic or the old Everett Clinic or Polyclinic is that the only Advantage plans they're going to accept are the United Healthcare plans, which just happens to be owned by Optum. And that's a real problem a lot of people have with if they're being forced into a medical plan they do not want in order to see doctors they want to see.
Mm-hmm.
Because a lot of them we're looking forward to supplemental plans, and they're telling the new turning 65 people that they will not accept the supplemental plans, and they are basically enforcing it right now.
Yep. Yep. Yeah, thank you for that. So I'm taking notes on that. So I got three things about the provider list being inaccurate, and Brian dropped a note in the chat. Yeah, that's a continuing challenge, but we can definitely reinforce that. And then the PPO HMO thing, I mean, you absolutely understand the dynamics around that. It's about managing the quality, managing the referrals, optimizing their reimbursement, and I owe you all I've had a couple of questions about that and a request to address it more fully. So I will do that. But basically that's the dynamic, and we did see that in several places around the state. This was a very big deal in Yakima County. Carol, it may have overflowed a little bit to Kittitas County, but essentially there's one hospital in Yakima. They don't want PPO plans with one exception, and so folks are going to be loyal to their provider, not their insurance, but switching is arduous, right? And so it's a big deal. It's going to continue to be a big deal. Also, your analysis about the Optum clinics is right on. So imagine like a big corporate United Healthcare holding group, and they're the corporate owner of United Healthcare Insurance Company as well as Optum. And so then Optum in turn owns the Everett Clinic and the Poly Clinic, and they have now essentially said we're not doing business with Humana, moving the enrollment into United Healthcare. Just at the end of the year, I think on the 22nd of December, about 16,000 folks in Humana got a note saying they are entitled to a special enrollment period starting like December 2nd, going to the end of February. Those notices as well include contact us for assistance. So we're going to get a bunch of calls, and it's not going to be easy for the volunteers to navigate, but essentially we want to kind of hear people out, but then move towards, like, practically speaking, you're going to have to make a change of insurance if you want to continue to use that clinic, right? So it's going to be delicate because you can't just let them editorialize. They're going to have to take a decision in a timely way. And I think this is going to continue. I mean, I just think that what I would call like this kind of vertical integration, I think that that's going to continue to be real. And, providers and insurance companies are both trying to get some leverage in this conversation. So we're going to continue to see beneficiaries kind of deal with this fallout for a while, unfortunately. But I'll take a note to follow up with you about the provider list, and as with Peggy, we can pass those forward to CMS. And from the program that Elena put together at the end of the year, that there is a special enrollment period for people that relied upon the Plan Finder tool. The tool was in error. They enrolled directly from the tool. They can also get a chance for a second change. But again, arduous, not easy. But thank you. You guys had a good year out there, by the way, according to STARS data. And I know you're going to put yours in around Valentine's Day, but your group had a good outing. That's me teasing you, and not. I know you're more timely than that. Okay, how about let's talk about 2026, the year that's ahead of us. So this is really the same business plan. It's the same long-term trajectory that we've had for a while. We're going to work on in our team formalizing this a little bit with some project plans, and we'll be happy to share that calendar back to you all as well, and hoping to provide some more support for our sponsors with their work plans. But first order of business, obviously, enough diverse, proficient volunteer advisors. As I said, my goal is to kind of grow our network from about 200 to about 600 over time. Outreach marketing and referral means that no one's ever heard of the Insurance Commissioner's Office. No one's ever heard of the SHIBA program. So just trying to raise awareness of the program and really reinforce that connection back to our local partners. So if you need help with Medicare and you live on, Whidbey Island, please seek out Island Senior Resources. If you need help with Medicare and you live on Orcas Island, please reach out to go to the Orcas Senior Center, and they keep office hours there. So really trying to raise awareness of the OIC, the SHIBA office, but also to really promote you all as our local partners. I committed to Paul in the chat. I'll give you some data about website traffic, but based on the BCR data, the number one answer to how did you hear about us is I'm a past client. So highest marks for loyalty. People like working with you. They trust you. I know lots of times they reach out to you directly. They just call Lou directly. They didn't even call Aging and Long-Term Care or Mike or us. They kept Lou's number and they call him again next year. So we want to just stand up, our presence more consistently, more forcefully across the year to do that. And of course, work on the quality of the referrals from us to you. Number 3 is collect and use our data so that we can continue to influence policymakers, so that we can continue to advocate for the resources that we need, so that we can make smart business decisions about what are our training topics and what are the contemporary issues that we have to respond to support you. And then, as I said, we invited Callie into our team to supplement the work that Philip and Diane are doing on what I call complex cases. The workload for that team increased 64% year over year. So this is just a lot about the complaints that we get, and a lot of these are about Medicare Advantage plans, about the friction people have about switching plans, about rate increases for Medicare supplement plans, right? The list goes on. We get a lot of those cases come directly to us. We refer as many as we reasonably can back out to you. I always want to, kind of hold up the question, can a volunteer work this before we assign it to a staff person? But we are assigning more and more work to ourselves because of the complexity of the cases. We are seeing increased referrals related to fraud, which is all to the good. So credit to Kim McKenna and credit to you all for helping to promote that awareness about the Senior Medicare Patrol Project. But it does create kind of workload demand in our team. So part of what's behind increasing our staff complement is just being able to keep up with the work that we assign to ourselves compared to referring back to you. So at a high level, that's kind of our direction for the year ahead. And can we go ahead to the next slide, please, Susie? So for the first quarter, for January, February, March, priority work for us, of course, volunteer recruitment campaign. Everybody has a New Year's resolution to be a better person. And so be a better person by being a SHIBA volunteer. And lots of people have now had the experience of how difficult Medicare is and open enrollment is. And it kind of motivates a lot of people to say, maybe I could give back or I could help somebody the way that I would help. So the timing is right for us in terms of motivation, and it gives us a little bit of a runway so that people can get some training before the next open enrollment so they can be productive and apply themselves to helping. So we're going to do what we've done in the past, which is what I call like a direct mail campaign. So we're going to just direct mail to people's household and say, you might like to be a SHIBA volunteer. This is our local partner. And that works. And we'll kind of surround that with some paid advertising and then some obviously local outreach and engagement through our sponsors and volunteers. So your regional training consultant will be talking to your volunteer coordinator and your group about kind of staging this. What do we do in the space that you work in? When does that happen? What does that look like? But we just generally need to grow the network, but we're trying to do that in kind of a thoughtful, deliberate way because we have a lot of new, as I said, new sponsors, new partners, new volunteer coordinators, new staff on our team. So we're trying to just balance around doing it well with doing a lot. So volunteer recruitment campaign, priority one for Q1. And can we go ahead, please? So then some project work for us, also obviously for you. I want to be careful always to say that I know mentoring is happening. Mentoring has been happening. Mentoring is working great. I could look at Annette. I could look at Peggy. You're sort of like my paragon. You're my two volunteer coordinators, and you both do an excellent job with mentoring. Scott Opsel is on the phone, and Scott's doing an excellent job mentoring one of his protege. John is on the phone. So mentoring is happening, and mentoring is going great. And I'm just looking for the opportunity where our program can provide some more structure and support where we can kind of level up in terms of the documentation and formalize this a little bit, and also how to bring along brand new organizations and brand new people and do some succession planning. So we, at the last meeting in the fall, we introduced you to Tamara, and Tamara's on the call today, and Tamara's going to be our lead person for standing up what our mentoring support looks like for you guys. I think we had a great year in 2025 with online coursework. So Elena Garrison, working with our friends at WSU, Washington State University, they have this platform called Canvas. And so we've created a learning management system, online self-paced coursework, which has gotten good reviews. And we're going to continue to invest in supporting that work to supplement our instructor-led training work. As I said, a very good year for the Senior Medicare Patrol Project, and very grateful to Kim McKenna for her leadership. So we're going to continue to work on integrating the SMP project into basic training and continuing education training and that LMS platform so that we can grow our capacity out in the field to supplement the work that folks here are doing with potential fraud. In the year ahead, we're going to invest some more in our relationship with AARP. Gene Matheson is a longtime AARP volunteer, part of their Fraud Fighter campaign, public awareness, Speakers Bureau. So we're going to work on that partnership with them a little bit to lift up our work in this regard. And then hiring, of course, we're going to continue to hire for the positions that we have authority to hire so that we can, as with our volunteers, get folks ready to do productive work across the summer and into open enrollment, try to not have people burn out. What is the URL for that online coursework? Could I get somebody to respond to help Peggy with a link and a registration for that course? Thanks, Peggy. And Susie, could I ask you to go ahead one slide for me? Okay, so as I say, kind of stay the course, right? That's my motto for 2026. Like just keep building on the successes that we've had. But something that's going to be new for us and for you, you may or may not be aware of this. As I was talking to Shelley at the top of the call, if you work in an area agency on aging, or Devin is here from Kitsap County Aging and Disability Resource Center, you're already aware of this. But in Washington State, we now have this thing called the Walk Cares Fund, which as a working person, I pay into it through a payroll tax so that later in life, if I need, I can get some financial support to pay for facility-based care, like a skilled nursing facility or home-based care. So broadly, the technical expression would be long-term services and supports. I would be entitled to like a lifetime benefit of about $36,000. And what we're going to have, again, kind of unique to Washington State, is we're then going to create a market for private companies to sell what we're calling supplemental long-term care insurance. So as an alternative to traditional long-term care insurance policies, a person could buy a supplemental long-term care insurance policy so that they would have their Walk Cares benefit that they financed through a payroll tax when they were working, and then they can buy another policy that would kind of come alongside. We just finished our public hearing for rulemaking yesterday for that. So we're waiting to see about companies entering the market to sell these products. I predict it will happen straight away. So this is like an internal dialogue. Some people are more skeptical than I, but I think that we will see companies come into the market in the springtime and start offering these products. In the bill that passed, that the governor signed in the springtime, there is a provision in the bill that directs the OAC SHIBA program to create a consumer's guide to supplemental long-term care insurance. And so we will be hiring a position expressly to support the Walk Cares Fund and supplemental long-term care insurance, public education and outreach, and help us work with you all about whether some of you would like to expand your portfolio of counseling to include working on counseling about long-term care insurance and or supplemental long-term care insurance. So we'll be working on creating an invitation for you to be part of that effort. And then, as I say, especially working with our partners at the area agencies on aging. This is sort of set to go live in the summertime. So we should be actually paying benefits out of the system July 1. And so right now we have a pilot project with Spokane County Aging and Long-Term Care and the Lewis Mason Thurston Area Agency on Aging to kind of test the end-to-end process of receiving an application for benefits, engaging a provider, paying a provider. Our work is, again, standing up that consumer's guide. We're going to put together a work group of people to do the design of that. We will also revise the current consumer's guide to traditional long-term care insurance. So if I'm on time, we should be ready with all of those things by April, May. So that's sort of the timing of us rolling this out and us engaging you about what your interest is. If you live in Lewis Mason Thurston County, or if you live in Spokane County, you're going to hear from us more directly because our friends at DSHS, which administers the Walk Care funds, is asking for some help from us to help promote the awareness. So so like those folks more eminently, and then everybody kind of springtime, and then by summertime we'll presumably be actively helping people navigate these purchase and investment decisions. And can we go ahead one more, Susie? Okay, so before I launch into my future forecast, let me ask about feedback or questions about kind of what we're doing and broadly in 2026 and specifically in the first quarter, or about Walk Cares Fund supplemental long-term care insurance. Hey, Maureen.
I don't have a question about the long-term care insurance, but I do have I guess a question comment about the intention to increase the volunteer capacities and encouraging volunteers. And just wondering if there, and it sounds like you're putting in a whole lot more resources to assisting beyond the basic training. Is that correct?
Yes.
Because
Yeah.
I honestly would like to see something about best practices, some presentation on best practices for recruiting and retaining volunteers. It's our experience, unfortunately, is that a whole lot of energy is put into is offered to volunteers, and then they decide it's too much, they're not a match, and I'm just it's discouraging for those of us who are mentoring. And what are we doing wrong that we lose these folks who could possibly be really great volunteers. And so I would like to see something on getting some feedback from why people are leaving, or or for new volunteers, what has worked for them, what didn't work for them, where were the gaps, where could the agency have improved in terms of retention, or they would have felt more comfortable. So that's one comment. And then the second thing is a question. Is the OIC putting any intention, resources, plans into developing a call system, a tracking system that's beyond sending us an email? I just remember when I was first a volunteer, many years ago, we didn't have the STAR system. We had a state created system that we could put calls in pending, and the next volunteer took it, and blah, blah, blah. So we worked with the state system, and then the states had created that system. And as I understood it, then that system then fed into the federal, whatever the federal collection system was. And then when the federal system updated, the state decided not to update and decided to go with the Fed system. That's my rough recollection of how it happened. But I'm just wondering, because we have a system in place that is cumbersome at best. It works once you get used to it, but it is a stumbling block to volunteers because it requires, some computer techie kind of stuff. And so the person who might be a fabulous counselor, advisor, may not be the most skilled at doing the tech work. So there are barriers there. So the question is the state looking at doing some kind of a simplified tracking system for sharing the call log with the various agencies?
I'm again, apologies for looking away. I'm taking notes. So really, really super grateful for the questions, Maureen. So I guess let me say, as I said in the call yesterday, for me, the long-term vision, right, the excitement that I have about coming back to the program, it is 5 years this month for me that I've been back as the program manager. Is I really, right, for me, the goal is that this is a volunteer-run, volunteer-directed program. So, when I say that, someone like Annette or someone like Peggy, that's my paragon. I love the model of a volunteer coordinator. I always want to, whatever the work is, kind of start with the question of like, is this a thing that a volunteer could do? I mean, are we fully engaging? Are we really like interrogating that question and saying, does a paid staff person need to do this? At the end of the day, there's going to be work that we reserve to ourselves, but I really want us to not just have the workflow to the volunteers, but to do exactly what you're doing and saying, hey, as a volunteer advisor, this is the support I need from the state to be better at taking care of our Medicare beneficiaries. So I just want to really appreciate that those couple of observations and questions. Bravo, thank you. So let me do them in the order that you presented them. So the first question, for sure, we do a little bit of that. It's inconsistent. We can do a better job about sort of surveying people about did you have a great experience as a new volunteer, kind of an exit survey if they take off, whether that was 6 months in or 6 years in. We do that across the state. It's not as consistent as it could be. It's not as formalized as it could be, for sure. And I know specifically a couple of people that you're talking about, Maureen, like I'm thinking about Brian, for instance. We again, we just have to overinvest in mentoring, because I think that's the key to retaining people, is that we real immediately attach them to someone like you. And then I think our support needs to be much stronger in terms of what does the OIC support for you as a mentor look like. And I think that includes, going beyond basic training, that we have a kind of a steady, ongoing, more formal, like instructor-led training, right? More than just CE training, but programs like basic training that continue. I'm trying to, by my hand gesture, kind of indicate a continuum, right? And that volunteers, when they're starting, understand that, and they have a structured path. We don't have enough of that yet. So I think your insight is right on. I can, you and I have worked together for a long time. It's not you, it's us. And we have to own that. And that's what's behind recruiting Tamara into the team. And we have another recruitment out there to bring into our team, another person like Elena, to work on curriculum, to develop curriculum. So I think the gap is us. I think the burden is on us. And I think the dialogue with you and people like you, and again, Scott's on the call, and at Peggy, we have a lot of folks on the call that have done a lot of that kind of work of mentoring, and we need clearly to give you more support. So I think 100%. And so we're going to be spending a lot of the first part of the year having that dialogue with you about what are you doing now? From your perspective, how is it going? What can we do to make it better? But we're not trying to take it over, right? We're not trying to take it away. I'm not wanting to like pull it back into the field. I want to just make sure we're supporting what you're doing in the field. And I'm very comfortable with it not being the same. I don't need it to look exactly the same at Senior Services for South Sound as it does for Kitsap County, as it does for King County or Pierce County. I'm very happy with it being different in different places, as long as we have kind of standard work in terms of what is the work of a proficient volunteer. What does a model consultation look like? I feel like we have to own that standardization. So I'm 100% agreeing with you on the first point. On the second point, yes, the first time that I was here 25 years ago, I started my career in state government working here at the OIC, and I helped design, build that system that you're referring to, right? The CAT system. So I know that system. I literally went around the state and trained people to use that system. And you're exactly right. When the new version of the STARS database came, we let go of it. I think that was a mistake, but I'm not going to, relitigate some decision that some other administrator made. But it is on my list. We asked for money in the budget proviso to do that, to stand up a new product. I was not able to get it done last year, but it is on my list for this year. I've had those kind of initial kind of scoping conversations with our IT team. It's technically feasible. It just is going to take kind of some project management discipline. So we're actually, say in the next week or two, we'll have a job announcement for a project coordinator in our team, and that will be part of their portfolio. So it is feasible. I share your point of view about the utility of it. And I just, at this point, I can't promise anything about like, when does it come online? But that is the direction we're going, for sure. In the short term, we'd like to just figure out how to improve the quality of the referrals, make it less cumbersome. Don Randall's going to be next, and they have their own grid that they use up there in Edmonds. And so, yeah, every organization has kind of created their own, I'll say, workaround. But I'm going to see if we can come back to a more standard system that we all share. So 100% on both of those things for sure.
Well,
Hey, Don, good morning. Nice to see you.
Yeah, just to follow up, if there are other agencies that have models of how they do it and are willing to share it, that would be useful in the meantime.
Of course. Yep. And Kelly Hudson is your volunteer coordinator, and I know she connects with the other volunteer coordinators on a regular basis, but we can follow up and ask about that, where it's at. Yep. Because it's going to take us a little while to stand this up. Hey, Don, good morning. How are you?
Hey, good morning. Good discussion this morning. Glad I tuned in. Two things. One is the recent your last discussion triggered one thought we had coming out of open enrollment was we don't have a way to automate reminders to people.
Yeah.
They call in, they get registered. We have to manually send them emails. It'd be great if it was like the dentist where you get 6 texts and 2 emails so that you will show up.
Yeah. Okay. I know
So
what you
that's
mean. I get that. I had an eye appointment yesterday.
Yeah.
A month ahead, a week ahead, a day ahead. It's an hour till your appointment. I got it.
Exactly. That's the one. And the second thing is kind of I'd circle back to Social Security is that, not really for open enrollment, but through the year, people new to Medicare or people making changes, it's become an issue. And I don't think it's going to change. I don't think it's going to improve. And ideally, if we had a bat phone to them, that would be great to get through the 2 or 4 hour wait. But if somebody in your staff specialized and they had access, that might be a helpful thing.
Yeah, I think
just to get us kind of. I applied in November. I don't have a Medicare number. I can't do anything. When am I effective on part? I don't know. Without 4 hour long wait. Or maybe that's something in a CE session, somebody from Social Security would be willing to explain to us how life is today and what we should do.
I think we can do both of those things, Don. So I'm
Yeah.
take a note, and yeah, I think we can for sure. It's as I say, every place does it differently. Like you don't do it the same way that Rebecca does it. Okay, so that's great. But if you're the guy who works Tuesday mornings from 8 to 12 and you couldn't finish, it's nice if we can pick it up and then give it back to who's ever working Thursday morning, right? So I think that staff contact idea makes a lot of sense to me. I also think, again, after getting on kind of the horrible side of the other side of the lockdown, shutdown, however we want to call that thing that happened with the federal government in the fall, our friends at Social Security love to talk to you guys. The CMS, DSHS, they love talking to you guys. And they really appreciate the work that you're doing, and they understand, the utility of it and the impact of it. So I can absolutely invite them, and we can organize a program where we can have that dialogue directly. So I'll take that as a note. Yep. And of course, the state of play is very fluid, right? So when we invite them in February and they say this, don't mortgage your house on what you hear. Okay. 15 minutes to go. Let me just do a quick kind of future forecast for you, and then let's kind of keep talking, but I appreciate the conversation. I've had a lot of questions for obvious reasons about what's happening with federal funding for the SHIBA program, and the answer is it's secure. So I don't have any worries about ongoing federal support from Department of Health and Human Services. Having said that, it's going to be flat. We're not going to see increases in our funding for a really long time. So we absolutely need them as a partner, both financially and also in terms of the access that it gives us. But we're going to have to work harder to secure more state support for funding and for other resources, including technology, as well as our other partners inside state government and out in the community. So I feel very sure in the support that we have from Patty Kuderer, our insurance commissioner, Charles Malone, our chief deputy. As I said, we had successive decision packages to increase funding support and staffing support. I feel very good about that. And so we will be continuing to move towards increased state investment because the federal funding is not going to keep up. But the relationship with the feds, I think, is secure. The legislature comes back to town, we say, next week. It's going to be a very, very tough session if you follow the news. When the February revenue forecast comes and the caseload forecast comes, it's going to be, a really, really tough outlook. So I expect that we're going to see further spending reductions, cuts in programs, reduction in force. People are going to be laid off or reassigned. So it is going to definitely complicate our work in terms of DSHS and HCA and employment security and DRS and other agencies that we work with. It's going to be a tough year. So I don't want to kind of sugarcoat that. And I'm appreciating that it has consequences, kind of downwinder consequences for us. So it's a short session. If they finish on time, 60 days, which my forecast is they will finish on time. There won't be any policy work. It's all going to be budget work, and it's going to be more cuts than anything else. So a tough session ahead. Kind of pivoting from the state to the federal level, 2026 is going to be a bit of a liminal year. I say HR 1, House Resolution 1 compared to One Big Beautiful Bill. My assessment that that's a beautiful bill. But, we had conversations in the middle of the year about changes for Medicare, changes for Medicaid. 2026 is that year where we start to see those things come online. So in the short term, eligibility changes for Medicare for non-citizens on a going forward basis, right? We changed the eligibility rules. In January, we're going to start revoking people's eligibility. And so we're going to do a lot of work around education and outreach, especially for people that don't have English, about what the impacts of that are going to be. Our state will be negotiating with the federal government about what does work requirements for Medicaid look like. I'm sure that we'll submit a waiver application. I'm sure that will be rejected. And so we're going to be negotiating about what does implementing work requirements for Medicaid look like. That's going to be a relatively big deal conversation. And I really don't think there's any negotiation about moving from annual to every 6 months certification. The state's going to have to figure out how to operationalize that. It's administratively a huge thing, and coming kind of in the face of the budget and staffing changes that we're going to have. This is going to be administratively a formidable exercise. And so again, we have a lot of work to do to kind of use the SHIBA program to create that safety net, especially for our dual eligible people and folks that are transitioning out of the Affordable Care Act or Obamacare or health benefits exchange plans. I'm honestly very sanguine about whether we're going to get any relief in terms of the enhanced premium tax credits. I don't think it's going to happen personally. We're for sure not going to continue with what we've got. So if we have a negotiated solution where we retain subsidies for some people, lower income compared to other people, higher income, it's operationally, that's a difficult thing because the rates that the companies make have to be reviewed and approved by us. So even if our federal elected officials solve a policy decision, there's still going to be an operational impact. So we're going to have a lot of people get dislocated from their ACA plans in the first 6 months of the year that we're going to have to help them figure out navigating kind of back to Apple Health or forward to Medicare. So I'm just saying that 2026 is going to be a tough year kind of in its own right, and then anticipating the changes that come in 2027 for Medicaid. And then last, I'll just say that many of you are aware about this WISER project, which is about trying to, not pay for things that are not appropriate, that are not medically indicated. Senator Murray and Senator Cantwell introduced a bill a week or so ago that would keep this from happening. I don't think that bill is going to go forward and influence the implementation of the project. So we're working on helping support you with reporting issues or concerns that beneficiaries bring to you. I committed that we would track those as complaints and report them back to our federal delegation. So we're specifically looking for things like delays in getting needed procedures or confusion about covered or not covered services. So say in the next couple of 6 weeks, I'm going to have some kind of like talking points for you about working with beneficiaries, and then some direction about how to help us capture those data beyond the direct reports we get when it comes up in your consultations, especially if someone had like a practical problem. We want to make sure that you get those to us and we get them forward. So next slide, please. All right, I'm in the home stretch here. I hope, it's my job to kind of focus on the problems, but honestly, I feel very hopeful about the year ahead and where we're going. And that's everything about my confidence in the great work that you are all doing. Each and all of you are an inspiration to me. I just feel like if if we were living like in an ideal community, it would be populated with people like you doing the kinds of things that you do. And so I just feel like very hopeful. Like there is kind of a bright shining example of what this looks like when it's going the way it's supposed to go. So I just show up every day animated and excited about the work, and especially about working with you. So as I said at the outset, my first purpose in organizing these calls is just for you to hear very directly a thank you from me on behalf of um, the leadership of the organization and the insurance commissioner. I really am sincerely grateful for the work that you do, and I know the difference it makes. And I just want to say thank you. And I am looking forward to coming out and seeing you soon. So please invite me. Please invite your RTC team. This relationship really matters to us, and we're trying to be a strong partner for you. So I have some more time today, but what else you want to talk about that I've missed? If I didn't pick on you and you want me to pick on you because you feel otherwise that I've neglected you, just raise your hand and I'll pick on you.
Without raising my hand, can I ask you a quick question? One of my newer volunteers said that in yesterday's town hall, there's quite a bit of discussion about the Welcome to Medicare kits.
Yeah.
And she asked me about those. I'm not sure what those are. I mean, I have ones that I create for my volunteers out here, but there seemed to be something else that she was talking about. Could you educate me?
Yes. Just by way of orientation, Peggy is our volunteer coordinator at Orcas Island. And do you still do a hybrid program, Peggy, where you do an in-person and hybrid at the same time?
We have the hybrid for people who want it, but we're almost exclusively in person, and we have been since 2021.
Okay. So kind of around the state, different volunteer coordinators and programs are doing something like what you do, and it's a very non-standard approach, and that's great. And we would love to support you in doing whatever you're doing. The feedback yesterday was around Maureen Hill from Senior Services for South Sound, which is where Maureen works out of, brought the suggestion that the toolkits worked really good, and lots of times when we go out to do a presentation about open enrollment, we attract a lot of people who are there because they're turning 65 2, 3, 4, 5 months ahead. And so she was asking kind of about customizing the toolkit to be more responsive to a mixed audience, and or going the other direction and kind of customizing the packet that they go out to the field with around Medicare open enrollment stuff.
Oh,
So
okay. Because I use the portfolios that you can get through fulfillment and then some of the basic materials, and we provide those in all of our Welcome to Medicare presentations.
yes. So I think it's a question about, is there an opportunity among the volunteer coordinators and the folks like Don Berg that love delivering that presentation to kind of just share best practices, learn from each other. A suggestion that Kelly had was like she kind of liked the look and feel of the open enrollment toolkit. It was a little bit friendlier. The graphics were more engaging. Could we kind of apply that same style guide? Yes, we can absolutely do that. I guess the carry on to that is that we have historically had some really good relationships with some of the local community colleges. I don't know if my friend Scott is still here, but Scott on the regular does a program through the Whatcom Community College, and it's organized around that Welcome to Medicare or Getting Started in Medicare. And we're hoping to expand the partnership with several more of the community colleges in the year ahead. There's Scott. So yeah, so what we have is like a standard slide deck that we created that you all have customized. Again, very comfortable with that and just looking for where can we support you. But we're not looking to kind of create a product and then ask you to use it as much as we're saying, tell us about what you're doing and how we can support it. What do you want to say, Scott?
No, I'm good. Nothing to add.
You consistently have really good enrollment at that program, and you let me sit in on yours one time, and you do a great job.
Unannounced, you came and sat in on my class.
Well, I registered.
Yeah.
But
Yeah,
that's
glad to have you.
I could have called you and told you I was going to be there. Yeah, and so for those of you, Don Berg is one of these folks that does these presentations. As we look at expanding this and doing it other places and kind of cross training a bit more, we would love for those of you who are accomplished presenters to help us invite more people into the opportunity. And Peggy, apologies I haven't been able to join your program yet, but I would love to sometime. Don Berg, I think I got to see you do this at the library in Bellevue one time, right?
That's correct. I've moved out of Bellevue now. I'm down in Tacoma.
Yep. Yep. All right, friends. It's 12 noon. I want to respect your time. Very much appreciate you being here. As I said, Susie's recording the call. She's going to post it to the website. We have one more program tomorrow. You're absolutely welcome to join that one. I hope this was a good use of your time. I'm very excited to see you and Happy New Year, and I'm looking forward to seeing you again soon.
Thank you.
Good to see you, Lou.
Thank you. Bye.
Thank you. Bye.
Welcome.
Thank you. Bye-bye.
Bye. Thanks for coming, Celeste.